Now we're going to see the standard prenatal care. So standard prenatal care, we're going to divide it into 4 things. First is the weight gain. Second is nutrition or supplementation. Exercise. And let's say avoidance of things. So weight gain. The amount of weight gain we want the pregnant woman to be gaining depends on the body mass index the patient had. So if she was underweight, this means if she had a body mass index before being pregnant less than 18.5 kilograms per square meter, we encourage her to gain between 12 to 16 kilograms as a total during the pregnancy. If she has an acceptance weight before pregnancy, let's say body mass index between 18.5 and 24.9, so she should gain between 11 and 16 kilograms during the pregnancy. If she is overweight, she was overweight, this is if she had a body mass index between 25 to 29.9, she should gain between 7 to 11 kilograms. And if she was obese before pregnancy, meaning body mass index greater than 30 kilograms per square meter, she should gain between 5 and 9 kilograms during the pregnancy. Like a general rule is the patient should gain like roughly 1 pound per week after 20-week gestation. Around during the first trimester, she should gain between 5 to 8 pounds. Now, talking about nutrition, the most important thing is the prevention we can have taking folic acid. Every woman which is between 15 to 45 years old, which is in childbearing age, should take 400 micrograms of folic acid. Let's say if a woman wants to get pregnant, she needs to take 400 micrograms of folic acid like 3 months before pregnancy. Indeed should be 1 month before pregnancy, but we always encourage to have like a longer period before they start to get pregnant, because we never know. So we will say 3 months before they want to get pregnant, they should take 400 micrograms of folic acid. But we are going to encourage them to take 4,000 micrograms of folic acid in the case that the woman had a previous baby with neural tube defect, or if the patient has a family history of neural tube defect, or if she had overt diabetes mellitus. We can think about this as if the patient had diabetes mellitus 1 or 2, type 1 or type 2. Indeed, the definition of overt diabetes mellitus is first diagnosing hyperglycemia during pregnancy, but we are going to define this later. So basically, if the patient has diabetes type 1 or type 2, or if the patient is taking something that decreases the amount of folic acid in the blood, which the classic example is when the mother is taking anticonvulsant drugs, for example, carbamazepine or valproate acid. These decrease the levels of folic acid. But besides this, the amount of folic acid encouraged is 400 micrograms. Just for this could be 4,000 micrograms. Also, the patient should take iron because the patient is making more red blood cell, and also because of the fetus, we increase our demand of iron. Also calcium. If the patient is a diabetic patient, they should take vitamin D and B6. But besides, the most important supplementation is folic acid. Besides that is just iron, calcium, and in this case vitamin D and B6. Exercise. She should exercise during pregnancy 30 minutes of moderate exercise. As a general rule, she can do any kind of exercise except contact sports. For example, she can do weights, she can run, well, not run because there is an increased risk of falling, but she can walk, she can do treadmill, for example, and avoidance. So pregnant woman or a woman that wants to become pregnant, they should avoid caffeine. They should avoid undercooked meat, egg, or fish. Unpasteurized milk or dairy products. Obviously, avoidance of abuse drugs, substance drug abuse, and avoidance of fishes which contain high amounts of mercury, because this can damage the fetus. So standard prenatal care is weight gain, nutrition, exercise, and avoidance of high mercury containing fishes, unpasteurized milk, undercooked food, and caffeine. Weight gain should be dependent on the pre-body mass index the patient had. Exercise 30 minutes of moderate exercise. Any kind of exercise is fine except contact sports. And nutrition, the most important is folic acid, 400 micrograms daily, unless the patient has a previous baby with neural tube defect, over diabetes, family history of neural tube defects, or things that decreases folic acid levels in the blood, then they should take 4,000 micrograms of folic acid daily.